It's very common to hear people remark that we should treat people with substance abuse issues differently than we should treat people who have other mental health diagnoses. And the rationale that's given is that addicts have a choice, whereas other people with mental health diagnoses don't have a choice. And so it's a question that bears some investigation. Do addicts actually have a choice? Well, the answer, of course, is that yes, there is a choice involved. But that choice needs to be considered in the light of its various contexts, some of which are very unique. And the other thing that we need to do is beg the question on whether or not people with other mental health issues don't have a choice. In other words, whether that remark is accurate. So let's take a look at the context in which addiction should be considered as a choice. First, as we said in some recent slides, it is counterintuitive for a person not to use drugs. They, after all, do satisfy 5 of the 6 components that we need to have in order to see a behavior as highly functional. And it's contrary to our very biological impulses to turn away from things that feed these pleasure centers and these same drives that we use every day to determine what we'll do. So some of those drives tell us how to avoid pain and fear, and others tell us how to seek pleasure and how to nourish ourselves. And drugs drive straight at those exact same biological impulses. The choice not to utilize a drug is often one that is very scary and unknown for the person who's been using a substance for an extended period of time. As much as it might be difficult for us to relate to this, the drug becomes the career for that person and the core factor in determining their social circle. So to abandon a drug is often the same as abandoning a group of friends and a connection to other people. And it's also a way of saying, I'm going to abandon my reason for existing in many people's cases. And so they suddenly are found without any idea as to how they are to navigate through their lives. And in many cases, as we know, people have alienated influences, social connections that were once positive in their life, and so they're not sure if they can go back and mend those fences or turn to those same people. It's often a decision that is made alone. Other people in that social circle will not necessarily want to turn away from the drug at that time. That's highly unusual for more than one person to decide with the same conviction that they're going to abandon the use of a substance. And as we said, that person is often isolated from others. In fact, that isolation, that feeling of loneliness, can be the underpinning for why a person began using the substance in the first place. And so what you're choosing is not just to not use a drug, but you must do that somehow in a moment of lucidity, which can be difficult when the drug itself is impinging on your lucidity. And you must do it without anybody else telling you that it's a good idea, without bolstering you, without being able to bounce it off them and reflect. Addicts don't often have very much don't have very much hope, and yet the decision to get off a drug requires hope. One must actually have a belief that things can get better. One must also have a belief in self-efficacy, that one is able to be strong, one is able to actually continue on with something. And that can seem like an insurmountable mountain for many, many people. It also can sometimes mean for the individual that they're going to have to tolerate being sick in the short term and or in pain. And as a result, that makes it a very averse decision for most people, especially if they know that it's a medically risky thing to go through drug sickness. People need to know where they can start when it comes to making that choice, and that's often difficult for people. They aren't always aware, and sometimes those decisions can be right under their nose, but they aren't necessarily something that they have perceived or seen, again, often because they're under the influence of a substance or because their social circle may have maligned some of these other places, may have told them experiences that they had there that were negative and that sort of thing. And so people sometimes are walking past every day a storefront that might actually be able to provide them with some kind of treatment or intervention, but because of the social feedback they've had, they've decided before they've ever gone in the door that that place is not for them. And in many, many cases, as we've said, the individual has an underlying medical or psychological issue that they were addressing through the use of an illicit substance. And so that means that if they are to remove that illicit substance, they are going to often have to experience a lack of treatment for their trauma or mental illness, and then now they have nothing to help them deal with those underlying symptoms. Now, before we go off this slide, it's clear that addicts, while they do have a choice that is extraordinarily difficult to make. And so we have to be realistic about why people don't make it, especially all at one time. It's an illusion that an addict makes a choice once that's sort of like flicking a light switch, and then from that point forward continues on a path towards sobriety and wellness. The reality is that the addict has to make that choice and continuously make that choice every single day, often multiple times in a day. And that's why the treatment for many people who are addicted involves lots and lots of social feedback, lots of touchstoning with other people who are clean and sober, lots of points of contact with support people. Because at any given moment, this condition of being called clean or sober is able to be polluted or destroyed by the simple use of a drug one time. And so that's a very difficult thing to sustain. You can imagine that basically what we're saying is that person has to keep juggling that thought along with the rest of their life thoughts for the rest of their lives. They have to somehow be mindful and conscious of why they aren't using a substance, even in spite of all of the things that life will throw their way from that point forward. And this is why it's so important for people who are addicted to learn to do this step one step at a time, or one day at a time, as you hear in many 12-step programs. And it's also why people are taught to sort of try and make life as easy as possible for themselves, particularly in the early going, because it is extremely difficult to make this choice. Now, we have to go back to something else we said earlier. Is an individual making a choice to become an addict if they use crystal meth or use crack cocaine when they're 14 and 15 years old? And the truth of the matter is that the individual using that substance at that time can invariably be found to be an individual who simply does not believe or understand that the use of that substance once or twice can lead them on this path. And so people don't choose to become addicted, and when they are addicted, it can often be an extraordinarily difficult choice to seek treatment and move towards wellness. Now let's go back to that original question. Is it true that people with other mental health needs don't have a choice? And the answer to that question, especially if you go back and think about what we learned in modules 5 and 6 about involving members of a team, is that people with mental health disorders have many pro-social and pro-self-care choices that they can make. So it isn't just stuck with people who have substance abuse issues. It's also consciously true of people with any other issue. And it's equally challenging for many people to overcome the very symptoms of their disorder to address their disorder. And so one has to use one's healthy mind, so to speak, to address one's less healthy mind. And that is much easier said than done because it has to be sustained. So it's a bit of an illusion that only addicts have made some kind of choice that keeps them unwell. For a person who's struggling with any kind of mental health disorder, they have to make conscious choices and be mindful day to day to do the things that keep them healthy, including staying connected to care, staying connected to social assets, taking medication, taking care of themselves physically, eating right, sleeping right, exercising right, and avoiding many of the things that they know are triggers for their mental health symptoms. And that crosses the spectrum. It doesn't seem to matter what mental health disorder we're talking about, from addiction to anxiety disorders to bipolar disorder. It doesn't seem to matter. The individual has a number of choices that they must make on a regular basis, and we must support that individual in making those choices if they're going to be successful.